Mr. President, this is a motion that Senator Thune and I are putting forward, and it's a very simple motion. I think a lot of people don't realize that the taxes in the bill that we are discussing actually start in about 3 weeks. They start in January of 2010. But the effects of the bill, whatever the proposals are going to be in the bill, whatever programs are available, will really not come into play until 2014. So the taxes will start this next year, and they will be paid for 4 years before any of the programs that the bill is supposed to put forward will be there. So the amendment that Senator Thune and I are putting forward merely says that the taxes start being collected when the bill is implemented. So whatever programs are being offered to the people of America, whatever insurance programs, whatever kinds of benefits that there might be in the bill, would start at the same time as the taxes start. So you're not going to be paying taxes before you have any options that you would be able to take in this bill. So it's simple, it's clear. We believe that if you pay taxes for 4 years before you see any of the programs in this bill, that the American people can't really be sure that there will ever be a program, because there will be any intervening Congresses and an intervening presidential election that will occur before this bill is designed to start. 2014, we have congressional elections in 2010. We have a presidential election plus congressional elections in 2012. And 2 years following that, 2014, is when this bill will be implemented. So really, Mr. President, I hope that everyone will look at this amendment and support the amendment that we're putting forward. It's a motion to recommit the bill to fix this issue, that America should not be looking at higher drug prices, higher medical device prices, and higher costs of insurance, all of which are the first taxes that will take effect. Let's walk through it. Starting next year in January, 3 weeks from today, there will be $22 billion in taxes on prescription drug manufacturers that will start. $22 billion on drug manufacturers. So the price of prescription drugs, aspirin, anything that people take will go up because the drug manufacturers are going to start paying a tax. $19 billion in taxes on medical device manufacturers. So the medical devices that we use hearing aids that we use to treat ailments will start being taxed to the tune of $19 billion next January. And $60 billion on insurance companies starting next month. So that's about $100 billion in taxes that start in about 3 weeks. So that the insurance companies have probably already priced in the negotiations that they're having now with people about their insurance premiums. I'm sure that they realize that they're going to have to be locked in for a year or 2 or 3, and therefore these rises in insurance premiums are probably part of this bill that we're dealing with right now. $60 billion in taxes that will surely be passed to every person who has health care coverage right now. So, Mr. President, here we are. Health care reform that is supposed to bring down the price of health care in this country so that more people can afford it. And what is the first thing that we do? It's not offer a plan. It's not to offer any kind of program that would help people who are struggling right now because they don't have insurance. Certainly not going to help people who are struggling to pay their prescription drug prices, because we're going to raise the price by taxing the manufacturers of drugs, of medical devices, and the companies that are giving insurance today. So I think it is time that we talk about the high taxes that are in this bill. And what we're going to talk about in the Hutchison-Thune proposal, the motion to recommit, is to just say at least, the very least that we can do is not ask people to pay taxes for 4 years when you're going to have 3 intervening congressional elections before this bill takes effect. So things could change mightily. So all these taxes that are going to go into place might never bring forward the proposals that are in the underlying bill. In 2013, 1 year before this bill is to take effect, the taxes on high benefit plans go into effect. Now, what is a high benefit plan? A high benefit plan is one that is a really good plan. Many unions have these, and many people who work for big corporations have everything paid for. They have all of the employer regular, in the order that most companies do, payments, but they also allow in these plans to have most of the deductibles also paid for. They're very good plans. This bill will excise for those plans $149 billion. Just cut it right out and have an excise tax on those good plans. $149 billion, and that starts in 2013. That's 1 year before the bill takes effect. So in 2013, 1 year before there is any new plan put forward, those who have very good coverage, whether it be someone who works for a big company or whether it's a union member, will start getting a 40% tax on that benefit. So all of the things that have been negotiated are going to have a big 40% tax. That starts in 2013. In addition, in 2013, 1 year before the bill takes effect, there is a limitation put on itemized deductions for medical expenses. Now, today, if you spend more than 7.5% of your income on medical expenses, you get to deduct everything over that. So if you have a catastrophic accident, or you have a very expensive disease to treat, or you're in a clinical trial, something that's really expensive, if you go above 7.5% of your income, you can deduct that. In 2013, under the bill that is before us, you would have to spend 10% of your income before you could deduct those expenses. That is another $15 billion that will be collected in taxes that are not collected today. The new Medicare payroll tax, which impacts individuals who earn over $250,000 or couples who earn $125,000 each, would take effect in 2013. That's $54 billion in taxes. So these are all the taxes that take effect before the bill does, before there's any plan offered. You would have the tax that starts next month on insurance companies, pharmaceutical companies, and medical device companies. And then in 2013, you would have the tax on high benefit plans, 40% tax on that plan. And then in 2013, the itemized deductions will not be allowed until you've paid 10% of your salary in medical expenses. The Medicare payroll tax, which is going to impact individuals, All of this before there is a program in place. Then, in 2014, when the bill does come forward, so that there are plans to be offered to people, then you start the mandates on employers and the taxes if people are not covered. So you have $28 billion in taxes on employers that start in 2014, and these are the employers that just can't afford to give health care to their employees, or they don't give the right kind of health care to their employees. So it's not the right percentage, and if it's not the right percentage, then the employer pays a fee of $750 to $3,000 per employee. That's their fine. And then there is the tax on individuals who don't have health insurance, and that's $750 per adult. So my colleague from South Dakota and I will certainly want to spend more time talking about this, and hope very much that our colleagues will look at this. And I don't think this is what the American people thought that they would be getting in health care reform. Of course, what we would hope that the American people would get in health care reform would be lower cost options that don't require a big government plan. They wouldn't require big taxes. They wouldn't require big fees. If we just had a lowering of the cost by allowing small businesses to have bigger risk pools, that wouldn't cost anything. It just would allow bigger risk pools that would provide lower premiums, and employers would be able to offer more to their employees. Most employers want to offer health care to their employees. It's just a matter of the expense. And the bill that we're debating now is going to give more expenses and burdens on employers at the time when we're asking them to hire more people to get us out of this recession. Everywhere I go in Texas, when I am on an airplane, when I am in a store, grocery store, haven't been able to do any Christmas shopping, I must admit, so I haven't been in a department store, but nevertheless, I do go to the grocery store. So I will say that everyone that I'm talking to is saying, I can't afford this. What are you all doing? And I'm saying, of course, well, we're trying to stop this because we agree with you that small business people cannot afford this. I was a small business person. I know how hard it is because we don't have the margins of big business. And it is very, very hard to make ends meet when you have all the mandates and the taxes. And when you're trying to increase your business and hire people, which is what we want them to do, you can't do it if you are burdened with more and more expenses, as this bill will do. So what Senator Thune and I are doing is making a motion to commit this bill back with instructions to come back with the changes that will assure that the implementation of this bill starts, and that will trigger whatever programs are in the bill at the same time as whatever taxes and fees are going to be in this bill. Now, I would hope that there would be fewer taxes and fees, but whatever your view is on that issue, it is a matter of simple fairness that you wouldn't start the taxes before you start the implementation of the program. It would be like saying, I want to buy a house, and the realtor says, well, fine, you can start paying for the house right now, and in 4 years, you'll be able to move in. The house might be stricken by lightning, it might fall apart, it might blow up, it might have a fire, and that's exactly what can happen in this bill. This bill may not make it for 4 years. When people see what's in it, there will be elections. And I just cannot imagine that we would establish a policy of taxing people for 4 years, raising costs, leading down this path that will eventually go to a public plan that will end up doing what was originally introduced in this bill, and that is to end up with one public plan. It will take a little longer the way the bill is being reconfigured, but it is going to end up in the same place unless we can stop it by showing people that the mandates and the taxes are not good for our economy and they're not good for the healthcare system that we know in this country. Because we have choices in this country. We have the ability to decide who our doctor is and what insurance coverage we want, whether we want a high deductible or a low deductible. And that's not a choice that should be taxed. We shouldn't have someone tell us what procedures we can have. We should have the option of deciding that for ourselves with our doctors, and that's what we want in healthcare reform. But that's not what's in the bill before us, Mr. President. So I hope we can discuss the Hutchison-Thune motion to commit. We're going to work to try to make sure that everyone knows that we want fairness in this bill so that people know what's in it. And I hope that we will get whatever the new version of the bill is very soon so that we will have a chance to see if maybe there are some changes that are being made. But in the bill before us, the taxes start next month. And the bill is implemented in 2014, and on its face, that's fundamentally unfair. And I hope our amendment is adopted so we can change it. Thank you, Mr. President, and I yield the floor.